Start. Welcome back guys. Now in this video we'll be discussing about the pulse. Later we'll be discussing about the abnormal pulses. Okay. So first let's build up the concept. Here I'm drawing the left ventricular cavity, let's say. Okay, imagine this is the left ventricular cavity and you tell me from the left ventricular cavity what is the blood vessel that is going to come up. So here is the aorta. Okay, so here is the aorta. And what is this wall that I am drawing over here? This is the aortic wall which is in the closed state. First, what is the pressure that is present in the aorta? What is the minimum pressure that is present in the aorta? The minimum pressure that is present in the aorta when the heart is not contracting, that is 80 mmHg, you know. Okay, the minimum pressure that is maintained in the aorta is 80 mmHg. And what is the status of the aortic wall? It is in the closed state. So now you tell me what we have to do. We have to contract this left ventricular cavity. Okay, the left ventricular cavity have to contract so that the pressure will rise in the left ventricle. Now, why we need to increase the pressure in the left ventricle? In order to open the aortic wall so that the blood will be rushing into the aorta. Okay, so now here I am keeping the plus symbol, which means the ventricle is contracting. And you guys very well know that in the ventricular systole, how many phases are there? There is something called as isovolumetric contraction, rapid ejection phase and slow ejection phase. These three phases are there during the systole. Now I am going to begin with the systole. I am starting. So that is isovolumetric contraction. So tell me, during the isovolumetric contraction, the pressure is going to rise from where to where? The pressure is going to rise from 4 mmHg. Okay, the pressure is rising from 4 mmHg to 81, let's say. The pressure is rising up to 81 mmHg. Now, you tell me, the moment pressure becomes 81 here, that is the intraventricular pressure. Intraventricular pressure is more than the aortic pressure. So tell me what's going to happen? Immediately the aortic valve is going to open. Okay, the aortic valve is going to open and the blood will go into the aorta. So at 81 mmHg, immediately look here, the aortic valve is going to open. Okay, the aortic valve opened. But wait, you have left ventricle. Is it satisfied? Aortic valve opened. Okay, aortic valve already opened. But your left ventricle, is it satisfied? No, it is not satisfied. It is still contracting. Okay, it is still contracting and the pressure is going to rise from 81 to 120 mmHg. Okay, the pressure is rising from 81 to 120 mmHg. Okay, now you need to understand at 81 the doors got opened. Now the intraventricular cavity, this left ventricular cavity and aorta, now they are acting as a one single chamber. Okay, because there is a communication. Now you tell me, as the pressure is rising from 81 to 120, do you think the pressure here in the aorta is going to stay at 80? No. As you are increasing pressure here, the same pressure will be also transmitted. The pressure is also going to rise in the aorta. So that is the reason why in the aorta, the pressure from 80, it is going to rise up till 120 mmHg. Now in your blood vessels, the pressure is recorded as 120. Now you understand, during the systole, the left ventricular pressure increases as well as the blood pressure increases, the aortic pressure increases. Okay, that is the reason why we say the systolic blood pressure is 120 mmHg. During the systole, your heart is generating a pressure of 120 and your aorta is also generating a pressure of 120. The same pressure is getting transmitted. Okay. Now, my question to you here itself, just for the concept, my question to you, at 81 mmHg itself, the aortic valve is opened. Okay, the aortic valve is opened at 81 mmHg itself. Then why your left ventricle is still contracting and raising the pressure up to 120 mmHg? Why? Because see, just opening the aortic valve is not enough. You have to generate more pressure in order to push the blood into the entire vascular system. Okay, see, the blood vessels are going to offer the resistance, right? Okay, the blood, see, just opening the valve is not enough. If the valve is open, do you think the blood will go? No. So you have to create such a high pressure so that the blood will go into the entire vascular system. The blood will be going to all the tissues. You have to overcome the resistance offered by the blood vessels. Okay, the blood vessels are offering the resistance. So you have to push the blood. So for that, this much pressure is required. Okay, so now you know your left ventricle is generating a pressure of 120 mmHg. So the same pressure is also noted here in the blood vessels, 120 mmHg in the major blood vessels. Okay. Now, so what is completed? Isovolumetric contraction is completed. This phase which I am highlighting here in the, let's say, pink color, this phase is the isovolumetric contraction. Next, what is this phase which I am highlighting in the blue color? This is the rapid ejection phase. Okay, rapid ejection phase. And now later you tell me what is going to happen to the pressure. Now the pressure is going to decrease from 120 mmHg. The pressure is going to decrease to back to 115, 110, 100, 95, 90, 85, something like that. Okay, the pressure is decreasing. Okay, see, still the ventricle is contracting, but the pressures are decreasing because in the beginning it's the apex of the ventricle which is contracting. Okay, in the beginning it is the apex of the ventricle which is contracting. Now it is the base of the ventricle which is contracting. Right now I am talking about the base contraction. See, base is made up of thin muscles. So even though the ventricle is contracting, the pressures are falling. So now the pressure is falling to, let's say, 85 mmHg. Okay. So the pressure is right now decreasing, and right now the pressure is 85 mmHg. Now at this somewhere around 85 mmHg itself. Okay. The aortic valve is going to close. The opening of the aortic valve, when it happened, the opening of the aortic valve has happened at 81 mmHg. Okay, for easy understanding purpose, you can say at 81 mmHg the aortic valve is going to open, and when the pressure is decreasing less than 80, the aortic valve is going to close. But now I am talking more precisely, more specifically. Okay, now somewhere around 85 itself the aortic valve will close. The God designed aortic valve in such a way, okay, at 85 itself the valve is going to close. That phase is called as a protodiastole, we call it. Okay, so now say, as the pressure is decreasing here in the left ventricular cavity, also in the aorta the pressure is decreasing. Okay, pressure is decreasing from 120, it's decreasing back to somewhere around 85. Now somewhere over here at 85 the aortic valve is going to close. Okay, now this aortic valve completely closed. So now you tell me, in the beginning the pressure is increasing in the aorta, later the pressure is decreasing in the aorta. Pressure increased, later pressure decreased. Now at somewhere around 85 the aortic valve is going to close. Okay, now what will happen? Guys, you tell me where the blood is right now. The entire blood is there in the aorta. 70 ml of the blood, the stroke volume is there in the aorta. Okay, the stroke volume is there in the aorta. Now what we have to do? We have to send this blood, whatever is there in the aorta, forward. We have to send this blood forward. Okay, so now do you know what exactly aorta is going to do? See, whenever 70 ml blood came here, in order to accommodate this blood, so the aorta has actually stretched, guys. Now what will happen? Now it is going to recoil back. Now the aorta is going to recoil back to push the blood forward. So there is a elastic recoiling. This is called as a Wind-Kessel effect. Okay, this is called as what? Wind-Kessel effect. Okay, so now as the aorta is going to squeeze back, recoil back, what will happen? The blood will be pushed forward, and some amount of the blood will be also coming back and hitting the aortic wall. Some amount of the blood is also coming back and hitting the aortic wall. So this phase, this transient phase is going to rise the pressure again. Again the pressure is going to rise. The pressure is going to rise back. Okay, the pressure is going to rise back. So now you tell me, it is going to actually form a notch over here. See, there is a phase where you are forming a notch. A small notch is there. So this notch is called as a dicrotic notch. Okay, dicrotic. We are going to call it as a dicrotic notch. And you tell me what exactly is happening during the dicrotic notch. See, dicrotic notch is a phase where the aortic valve has closed. Okay, so this is the exact place where the aortic valve has closed, and after the aortic valve closure, the aorta is going to recoil back. So the pressure is again slightly raised. Okay, now what will happen when the aorta is recoiling back? The blood will be pushed forward into the next segment. Okay, so when the blood is leaving, so the pressure will again comes back to 80. Okay, as the blood has gone, the aorta has completely recoiled, the pressure has come back to 80 mmHg, the minimum pressure that is maintained. Okay, so now you have seen how the pressure is changing in your arteries. pressure is increasing, decreasing and again increasing and coming back to normal. Where you are seeing a dicrotic notch, only one question that they will be asking you. So dicrotic notch is a place where aortic valve has closed, the semilunar valve has closed. And you tell me, whenever the aortic valve is closing, that is going to give rise to which heart sound? That is going to give rise to S2 heart sound. Okay, so they will be asking you, sir, at this dicrotic notch, which heart sound is heard? It is the S2 heart sound is heard because the aortic valve closure, the semilunar valve closure. Okay, next tell me, this dicrotic notch is going to divide the systole. Here, this is the systole. But after the dicrotic notch, what do we have? Diastole. Once the aortic valve is closed, it is no longer systole now. We are going to trigger the diastole. Once the aortic valve is closed, we are going to start with the protodiastole, isovalvular relaxation, rapid filling phase, slow filling phase. Okay, so these are the important points which I want you to know. What and all that I have discussed with you, I will give a summary again. Okay, later I will show you the diagrams how the question will be coming. Again, my dear students, look at here. Here is the left ventricular cavity, and what is this blood vessel? Here is the aorta. In the beginning, what is the status of the aortic valve? In the beginning, it is in the closed state. Now you tell me, whenever there is isovolumetric contraction, the pressure is going to rise from 4 to 81 mmHg. Okay, the ventricle is contracting, the pressure is rising from 4 to 81 mmHg. What is the pressure here? 80. Now tell me, during the isovolumetric contraction, what is the status of the aortic valve? It is in the closed state. As the pressure is rising here, 81 mmHg, do you think the pressure is rising here in the aorta? No, because the aortic valve is in closed state. Now you tell me, once the pressure is 81, the aortic valve is going to open. The aortic valve opens. Now, the left ventricle is still contracting, that is rapid ejection phase. During the rapid ejection phase, the pressure is going to rise up till 120 mmHg. So here in the aorta also, the pressure from 80 mmHg is going to rise up till 120 mmHg. The pressure is rising. Okay, rapid ejection completed. And during the slow ejection phase, the pressure is going to fall from 120 to back to 85, let's say, somewhere around 85. Okay, so somewhere around 85, what will happen? This aortic valve is going to close. Now aortic valve closed. So as the pressure is decreasing here, see, from 120 to 85, as the pressure is decreasing, here also the pressure should have decreased. Okay, so okay, wait, I will give you the clarity. See, now as the pressure is decreasing, here also the pressure will decrease because the aortic valve is still in open state. Now the aortic valve is open, so the pressure is communicating, so pressure here also decreasing. Somewhere around 85, this aortic valve has closed. The aortic valve has closed. So this is the place where aortic valve has closed. Now you tell me, once the aortic valve is closed, now what this aorta is going to do? The aorta is going to recoil back, it's going to squeeze back to push the blood forward. So that is the reason why again the pressure is increasing. The pressure slightly increases and again come back to normal. Slightly increases, the blood will go forward, again the pressure will come back to normal. So this notch, this area which I am talking here, this is the dicrotic notch. And what is the valve that is closed during the dicrotic notch? Aortic valve is. What is the heart sound that is heard? S2 heart sound. S2 heart sound. Okay. Now let me show you the diagram that will be coming in your exam. Guys, look here. During systole, I have told you, see, during the time of systole, the pressure is rising. See, from 80, the pressure is rising to 120 mm. And during the slow ejection phase, the pressure is decreasing. Okay, the pressure is decreasing. Somewhere around 85, let's say, somewhere around 85 or 85 to in between 90, 85 to 90, or better, you can say 85. Somewhere around 85, who is going to close? The aortic valve is going to close. And once the aortic valve is closed, which phase is going to begin? Diastole is going to begin. But see, during the phase of diastole also, again the pressure is rising, that I have told you, because of the vascular resistance, that is because of the aortic recoiling. So pressure is going to rise. Now what is this notch called as? This is called as a dicrotic notch. Okay. And what is the heart sound that is heard during the dicrotic notch? S2 heart sound. Okay, that's it, guys. And this dicrotic notch is going to separate the systole from diastole. Okay, that's it. Now this is normal. This is normal. Now if you know normal, okay, in your medicine, in your pathology, okay, you will be studying about the abnormal pulses. Okay, the diseases where the pulses are going to be looking different. The morphology of the pulses is going to change. For example, this is the normal regular pulse, okay, normal regular pulse with a normal intensity. The pressure is rising and decreasing with the dicrotic notch, okay, something like this. This is normal. But see, there is a disease where you can have the dicrotic pulse, means you can see two peaks are coming, okay, two peaks are coming. So such kind of dicrotic pulse is seen in which disease? D for D. Always remember D for D. I am not going to the explanation why dicrotic pulses are going to be seen. Just I am telling you. Okay, these are the keywords in a 4-line question. Okay, the question, like very big clinical question is there, and where they are saying upon doing the physical examination, the patient is having the dicrotic pulses. Immediately you have to think about dicrotic pulses are seen with dilated cardiomyopathy. Okay, dilated cardiomyopathy, dicrotic pulse. Next, bounding pulse. Okay, bounding pulse means what? See, it is easy to palpate, very sharp rise in pulse, sharp rise, very sharp rise and sharp. Okay, is sharp rise in pulse. So that is called as a bounding pulse seen with aortic regurgitation. Okay, bounding pulses are seen with aortic regurgitation. Next, pulsus bispherians. Pulsus bispherians means two systolic peaks are coming. Actually, in a systole there should be one peak. Okay, and the other peak should be coming in the diastole. But here, two systolic peaks are coming. Both these are the two systolic peaks, and here is the dicrotic notch. So that is called as pulsus bispherians. Pulsus bispherians is seen in aortic regurgitation, but also seen very important thing, that is HOCM, hypertrophic obstructive cardiomyopathy, HOCM. Okay. Next, pulsus alternans. See, pulsus alternans, it can be seen with the left heart failure, which is not very important for your exam. Okay, left heart failure. Even if you forget pulsus alternans, that's not going to be a big deal. But this is very important. Pulsus paradoxus. So what exactly is this pulsus paradox? See here, this is the normal pulse. Okay, this is the dicrotic notch. See, during the time of inspiration, how the pulse is? It's a weak pulse. Actually, the pulse is disappearing when a person is doing the inspiration. When the person is doing the inspiration, you cannot be able to feel the pulse. There is a weak pulse, which you can't feel actually. And while he is doing the expiration, okay, while he is doing the expiration, again the pulse is coming. Okay, you can feel the high pressure and you can feel the pulse. So the pulse is alternating with the inspiration and expiration. The pulse is disappearing during inspiration and appearing during the expiration. This is called as a pulsus paradoxus, and such pulsus paradoxus is going to be seen during cardiac tamponade. Okay, cardiac tamponade, and also constrictive pericarditis. Okay, constrictive pericarditis also you can see the pulsus paradoxus. Next, pulsus tardus et parvus, or parvus et tardus you can say. See here, it's a weak pulse. Okay, weak slow rising pulse. Okay, weak slow rising pulse. Weak pulse, first of all, weak pulse and slow rising. See, you can see it's a very weak pulse. Okay, the pressure is not rising. Okay, first of all, it's a weak pulse and slow rising. The rise is also slow. It is seen with the aortic stenosis. Okay, this is also called as the anacrotic pulse. Anacrotic pulse, pulsus parvus et tardus, slow rising pulse, weak pulse. All this is seen with the aortic stenosis, and you know the reason why. For example, you say the patient is having aortic stenosis. Okay, let me give you a simple example. Sir, here the aortic valve is stenosed. Okay, the aortic valve is stenosed. Now, you tell me, when the aortic valve is stenosed, do you think the pressure transmission can occur? The blood can go into the aorta easily? No. Do you think the pressures can be transmitted easily? No. The stroke volume decrease, the cardiac output decrease, so the pressure. Okay, even with the one single beat, the amount of blood that is coming, the amount of pressure that is getting transmitted, because the aortic valve is not opening properly. So the pressures which are generated here are going to be less, and the blood is also coming slowly. Okay, not enough. So I should say that not enough amount of blood is coming. So it's a slow, weak pulse. Okay, so that is also called as the anacrotic pulse. Slow, weak rising pulse. Slow, weak rising pulse. Next up, water hammer pulse, also called as a Corrigan's pulse. Okay, it is seen in again aortic regurgitation. So a patient who is having aortic regurgitation may present with different types of pulses. For example, you see here aortic regurgitation, here also aortic regurgitation. So in this aortic regurgitation, based on the severity, different types of pulses can be experienced. Okay, so again I am telling you, for your exam, you should know what is a normal pulse, okay, and what is the reason for the dicrotic notch. And later, if you know the normal pulse in different diseases, okay, in different diseases, there will be different types of pulse. So why you should be knowing it? See, I will tell you, in your exam, if you see this word, dicrotic pulse, think about dilated cardiomyopathy. Pulsus paradoxus, think about the cardiac tamponade. Pulsus bispherians, think about the HOCM, okay, hypertrophic obstructive cardiomyopathy. So, in your exam, it will help you. And as a doctor also in your clinic, okay, just if you are experienced, say, if you are a well experienced doctor, just by the way you can feel the pulse, okay, no need of hi-fi equipment, no need of too many diagnostic tools, just the way you can feel the pulse, you can actually say what is something wrong with the heart. Dicrotic pulses will tell you dilated cardiomyopathy. Pulsus bispherians, HOCM. Okay, pulsus paradoxus can tell you what is something wrong with the heart. Okay, so just by the way you feel the pulse, you can actually say what is something wrong with the heart. Okay, that's the whole concept of knowing the pulses. Okay, with this, the topic is completed. Hope the video is helpful. Thank you.